Good morning. A couple moments ago, I posted a video, a video when I was headed to the doctors to go over my test results with my primary care physician. My test results for my A1C that went from an 11.5 to a 7.3 in 3 months and 1 week. And I was super psyched. Was almost as excited to go to that appointment as I was to find out about my 3 sons when I was pregnant. We got in there and I don't know what I expected, but I drove home silent because I think I needed to process it for a moment or two. So like I said, I really like my primary care physician. I'll go to her for anything, but I think we're at a cross path of something that I don't believe. When you get in there, the nurse comes in and asks you about your medications and things like that. She weighs you and goes through it, right? So she asked me about my medications. She asked me about my high blood pressure, my and metformin. I said, no. I'm not taking anything besides a multivitamin and my Feel Great system. So she took them off and she said, maybe it's just because of the new computer system. I let it go. It didn't matter. So then when my doctor came in, she pulled up the results like she did before. She put it on the big screen and then she had the other results on her screen. And I'm watching her look at it. And one thing that she's looking at it and she says, may I ask, why aren't you taking your medicine? Can you not afford it? Is your insurance not approving it? I said, no, I wanted to take, like I spoke to you before. She has 100,000 patients, so she probably doesn't remember. But I talked to you before, told you I wanted to try to fix this on my own. I don't want to be medicated. And then she said, okay. And then she went on and she looked at my results. She said, okay. She said, well, this is good. She goes, but we want you at a 7. And I said, but I believe 5.7 is a normal range. She said, well, you're a diabetic, so 7 is fine. And I said, but I don't want to be a diabetic. I want to get out of that. I want to not be a diabetic. She said, well, you got some weight on you, so you're going to be a diabetic. So I didn't know if she meant like, now the rest of my life I'm going to be a diabetic. So just do the best you can, get to a 7. I don't know if she's saying like, it's like when you lose weight, the last 5 pounds are hard to lose. Maybe it's hard to go from a 7.3 to a 5.7. I don't know, but I'll find out. I was taken back by that. So a few comments came through. She said a couple times, is it just because you can't afford it? And I said, I don't know if you can tell, but I didn't even go. I left it at the pharmacy and they put it back on the shelf. And she's like, the holidays are coming up. That it's not going to happen. So in my mind, I was like, I'm not going to do it. Here, hold my beer. That's what I felt like saying to her. Listen, I am going to do it. Again, I don't know how hard it is. Like I said, I don't know if it's as hard when you go from losing the last 5 pounds or anything. Maybe it is hard. Maybe from 7.3 to 5.7 is going to be harder. I don't care. For her to tell me I'm not going to do it because of the holidays or because I'm fat, or whatever she wanted to say, I don't think so. Like I said, I love my doctor. I'll go to her for my ear infections. I'll go to her if I ever get one or anything like that. But we are not debating my insulin resistance. I know this is a food-driven thing that I did to myself. And again, she's the one that went to medical school. I am not a doctor, but I have experienced this over the last 90 days, what I can do with fasting, my food, with weight training, and with my Feel Great system is exactly what I did. I told it to her a few times. She did not want to hear it. She said she did not want to even talk about the Feel Great system, but that's okay because I know in my heart I'm doing the right thing for me. And again, I'll go back and see her if I need her, but it's on. I need to prove to her and to myself that I can do this. Anyways, I just wanted to give a catch up. Thank you for listening. Sorry it wasn't so long. I tried to make my videos this long, but that was a lot in my mind and I wanted to dump it and share it. Tell me if you have any experiences like that. And if you have any questions about what I've done to get me where I am, I'm happy to share.